Good evening, everyone, and welcome to the Health First Graduate Medical Education Virtual Open House. I'm Mike Seeley, the designated institutional official for our GME programs here at Health First. I'm really glad you're here tonight, and I'm honored to help kick things off. This is an exciting time for us and hopefully for you as you explore where to continue your training. Tonight, you'll meet our great program leaders, learn about the opportunities that we offer, and get a sense of how Health First is investing in the next generation of physicians right here on Florida's Space Coast. Please don't be shy about participating. If you have questions, type them into the chat at any time. Ashley and Courtney will be keeping an eye on things, and we'll also save some time at the end for a free-flowing Q&A session. So let's jump right in. If we can go to the first slide, please. Let me give you a quick sense of who we are. Health First was founded in 1995, and for 30 years, we've grown alongside Brevard County. Today, we're a not-for-profit, fully integrated health system with nearly 9,500 associates, our own regional health plan, a medical group of over 500 providers, and a broad range of services from hospitals and outpatient care to hospice, pharmacy, and even fitness centers. At our core, our mission is simple: to improve the health and wellness of the communities we serve. We're proud of our history and even more excited about what's ahead. And now I'm very excited to introduce our Family Medicine Program Director and the Chief Medical Officer of Brevard Health Alliance, Dr. Ted Schuck.
Thank you, Mike, and thank you everyone for participating tonight. We're going to have a good evening, and hopefully we can answer all of your questions. I wanted to introduce as well the partnership with Health First and Brevard Health Alliance. At BHA, we are a federally qualified health center. We're the only FQHC in Brevard County. Our goal and our mission is to provide affordable access and accessible care, high quality care for every resident in our county. We currently serve around 55,000 residents in our county, about 1 in 10 approximately, and we have 15 locations throughout. These include very small centers and large centers, so a very diverse group of patients. We serve children up until adults and elderly, so we service full scope care to our patients and offer comprehensive services to support wellness at every stage. As mentioned, we really have a strong foundation of partnership, 20 years of partnership with Health First, and we were actually born from Health First, so a great partnership. In alignment, we look at our missions and Health First mission and Brevard Health Alliance mission. And the goal of Health First is to improve health and wellness throughout our communities, their vision, the future as well, and wellness is critical for this. They are a consumer-centric health and wellness center. And at Health First, the goal is what we call eye care. And that focuses on integrity, compassion, accountability, respect for all patients, and excellence. And as you can see, that aligns very much with Brevard Health Alliance's mission, which is to improve the health status of Brevard County by providing a medical home, patient-centered medical home, where all patients receive high-quality services. And we ensure that every patient receives the same services. They are heard, encouraged, and respected. Within the values of Brevard Health Alliance, we look at quality, care, respect, health, accessibility, and community, all critical elements. I wanted to introduce our team. I will start with myself, and I'm going to let our team members introduce themselves as well. We all come from very unique backgrounds, very interesting backgrounds. I think we have a wealth of knowledge. I started at Brevard Health Alliance in 2013. I'm an osteopathic physician. I went to PCOM, Philadelphia College of Osteopathic Medicine. I started from HRSA, which is HRSA is the Health Resource and Service Administration. And one of my goals coming out of residency and out of medical school was to really work on the underserved and work with the underserved population. We really we have a mission to service all patients in all aspects of health. I became the chief medical officer in 2019. I earned my MBA degree in 2016. So we take this mission and we understand the need for GME and ongoing education in our county. We're fortunate enough where last year we started FIT, the medical school, affiliated with BCOM, Burrell College of Osteopathic Medicine, to bring about the first medical school in our county. And in alignment with that, really what we want to look for is GME programs and GME growth. So I'm going to pass this along to Dr. Sarah Chuyik to introduce herself.
Hi, good evening, everyone. Thanks, Dr. Shook. My name is Dr. Sarah Chuyik. As Dr. Shook said, I am the Associate Program Director for the Family Medicine Residency here at Health First. And in my experience, I am a former program director in Georgia. I completed my residency in Georgia and stepped right into academic medicine after residency. I teach at several medical schools, including Burrell College of Osteopathic Medicine and Harvard Medical School. It's a true privilege to be here and to be a part of this journey in medical education. Thank you.
Thank you, Dr. Chuyik. And we also have faculty and the program director and assistant program director from our upcoming internal medicine residency program. So Dr. Michelle Lebrunda and Dr. Lionel Newmarch, I'll let you introduce yourselves as well.
Hello, good evening, and thanks for the introduction. I'm Dr. Michelle Lebrunda. I'm the program director for the Future Internal Medicine program, and I have a somewhat unique background. I've moved around quite a bit. I started in Arizona and kind of went around the United States. I've worked in the Northwest, Northeast, and kind of settled here in Florida in the Southeast. My training took place in New York. That's where I did my residency. And after that, I ended up coming to Florida, where I've planted roots and planning to stay. I've had experience in public health, global health, and I'm still passionate about both of those fields and plan to integrate many of those concepts into our internal medicine residency, as well as point of care ultrasound. I think it's a valuable tool, and we will be integrating that as well. I have a unique background because I've done a lot of global health. I've also done some locum tenens. I've been with Health First basically since 2008, so many years within the Health First system. It's a great system. It's in a process of undergoing a lot of changes, and I'm very excited about those changes. I'd also like to introduce Dr. Lionel Newmarch. If you're on, would you like to let us know a little bit about you?
Sure, thank you. Hi, everyone. I'm Dr. Lionel Newmarch. I went to med school at UCLA and did my residency at UCLA Olive View. I've been a hospitalist for about 12 to 13 years now. And I was a clinical instructor at the John A. Burns School of Medicine for the residency program in Honolulu, and then subsequently been living here in Brevard County. I've been involved in the medical executive committee at Cape Canaveral Hospital. I've been the chair of medicine. I've been involved in numerous different committees at Cape Canaveral Hospital. And I'm currently serving as a hospitalist at Cape Canaveral Hospital within the Health First system. I also am an assistant professor at Burrell College of Medicine. So good to see you, Dr. Newman, tonight. I thoroughly enjoy going across to Burrell and teaching the students. And now I've become involved as the Associate Program Director for the Internal Medicine Health First Residency Program. And I look forward to speaking to you all in the future. Thank you.
Thank you, Dr. Lebrunda and Dr. Newmarch. We're going to show a video of our county and what it entails. So please, watch as we go along here. needless to say, I think you can all see that it's a pretty excellent place to live and to work, and we'll further discuss that. And what we're going to look at now is our facilities and partnerships. Dr. LaBrunda, I'll pass it on to you.
Great, thank you. So I'm just going to briefly describe our hospitals. We've got 4 hospitals within our system. I've spent most of my career working at Holmes Regional Medical Center. It's a wonderful facility. It's got 550 beds. There are at least 500 skilled physicians. There's also a lot of allied health professionals and nurse practitioners that we work with. We've got 24/7 level 2 trauma care and also rapid transport. We have first flight with a couple of helicopters. We were named the best regional hospital by US News and World Reports with recognition across 11 specialties. And that's the largest hospital within our organization at this time. The second hospital I'm going to mention is Palm Bay Hospital. This is where the family medicine program will primarily be located. They will be unopposed, meaning that you won't be competing with other specialties. You'll have the hospital all to yourself for the most part. Right now, Palm Bay Hospital is 120 beds. There's 200 skilled physicians. There's a 27-bed emergency department, which is always busy. They are focused on cutting-edge technology, including digital mammography and X-ray technologies. The third hospital is Vieira Hospital, which is currently our newest hospital. They have 98 beds, including a very busy emergency room. They have a 24-hour emergency department. All of the inpatient rooms and observation beds are private, and they opened in April 2011. The last hospital is Cape Canaveral Hospital. If you've never seen it, you have to see an aerial view of this hospital. It's on an island. It's absolutely beautiful. It's surrounded by water. You can see the cruise boats coming in and out. It's currently a 150-bed facility with 200 skilled physicians. Their emergency room there has 21 beds. It's a level 2 emergency department. It also has an adjoining 6-story medical plaza. And I'd also like to mention that it's the only GI facility in Brevard County that does endoscopic ultrasound, which is a very cool procedure, and we're very lucky to have that capability within our organization. Next slide.
And then right now, we're making major investments to meet the needs of our growing community and to create outstanding training environments for residents, future residents like you. At Palm Bay Hospital, we're adding a 5-story patient tower with 60 beds and expanded surgical and procedural spaces scheduled for completion in 2028. At Vieira Hospital, we're nearly doubling capacity with 64 new inpatient beds, more operating rooms, and a badly needed expanded emergency department. The first phase will be ready by spring of 2026. And then on the horizon, the new Cape Canaveral Hospital set to open in early 2027. Ground is already broken on that facility. It'll feature 120 private rooms, a larger emergency department, and state-of-the-art operating suites. These projects are about more than buildings. They're about creating the best possible environment for patients, families, and for you, the physicians who will be learning and training here.
And moving on to the Health First Medical Group, this is our outpatient facilities through Health First. Their goal is to deliver comprehensive specialty primary care across our county. They have multi-specialties, including primary care cardiology, endocrinology, oncology, orthopedics, pediatrics, women's health, and a lot more. They support all outpatient care, wellness services, and we also have virtual visits. Last year, the service, we had over 777,000 patient visits by 430 providers. So pretty extensive in our county. And looking at Brevard Health Alliance, which is the community health center and the partnership with Health First, we are centrally located throughout. One of our sites, and the most important critical site for us at this time for the residency program, is the Valentine Clinic. At the Valentine Clinic, the goal is for us to provide primary care, family medicine services. That includes as mentioned before, family medicine, pediatrics, women's health. We'll learn procedures. We'll work with the pharmacy team, which is on site. The goal is really to support all outpatient services at the facility. It is very closely located to Holmes Regional Medical Center, which is the largest hospital, as Dr. LaBrunda had mentioned. Our goal is to give back to the community, service the community. And as I always mention at federally qualified health centers, you really see the most critical and interesting pathology. So it is one of the best places to learn is at federally qualified health centers. Dr. LaBrunda, I'll pass it on to you. Oh, I can take this actually. So we're looking at the new facilities under construction currently. At Holmes Regional, we're going to build a very large complex for the GME and the multiple residency programs that we plan in the future. Specifically at Palm Bay Hospital, we will be building our expansion for the purposes of the family medicine residency program. So we're going to have very nice on-call suites designed for comfort, overnight shifts. It's going to have the most up-to-date technology and support so you can work in the confines of really sophisticated area. We also plan to have classrooms at the Palm Bay Hospital for learning and for collaboration. In addition to that, at Holmes Regional Medical Center, we plan to have simulation labs for more hands-on and extensive training. We will also have focus on wellness and resident wellness to make sure that mentally and physically we're all in check as we go through arduous training programs. So we're going to have centers for that as well. Now, Dr. LaBrunda, I'll let you take it over.
All right, thank you. So I just wanted to point out that the family medicine program is part of a larger plan. We're actually going to be starting a number of programs within the GME. Family medicine is just the first one. We're hoping that we will get accreditation and that the program will move forward in 2026, but that's just the start. We have a lot more coming. We're planning to have internal medicine, which is obviously my area. And in addition to internal medicine and family medicine, we'll be starting emergency medicine, general surgery, OBGYN, also a transitional year, anesthesia, neurology, radiology, and who knows, maybe in the future we'll be able to add some other specialties as well. So we're really trying to grow our footprint. The idea is to meet the needs of our patients, the needs of our community, and to do that, we really need to start integrating GME programs, and we're hoping to be starting on that as soon as possible. I'm also going to mention briefly the benefits packages for residents. We will have comprehensive benefits for residents. They'll have medical, dental, vision coverage. In addition, there'll be financial benefits that include a 401k, life insurance, accidental death and disability, as well as accidental death and dismemberment insurance, as well as disability. There'll be paid time off, bereavement leave, pay for jury duty, and we also will have a very extensive wellness program. Both Dr. Shuck and I believe wellness is central to having a good residency program, and it's one of those things we're going to spend a lot of time developing. There are additional benefits that include meals, free parking, professional liability coverage. There'll be support for scholarly activities and continued medical education. Additional perks will include medical society dues, Florida reimbursement assistance for medical education, medical library access, as I already mentioned, the wellness community. And in addition to that, we'll have a competitive regionally benchmark salary. And I think we're back to you, Dr. Shuck.
Thanks, Dr. LaBrunda. We're going to walk through a video here, and I'll just, as we go through the video, I'll make mentions in terms of the importance of the Space Coast and the excitement of living in Brevard County. So Florida's Space Coast is a vibrant community where Health First and Brevard Health Alliance provide comprehensive care across the region. Within this partnership, the Family Medicine Residency Program trains physicians to deliver high-quality, patient-centered care. and residents gain inpatient experience primarily at Palm Bay Hospital, while outpatient continuity and community health rotations occur at the BHA clinics. These two hubs give residents a balanced full spectrum experience. At Palm Bay Hospital, you'll gain vital inpatient experience. And at BHA's Valentine Clinic, you'll anchor your outpatient training, building lasting relationships with patients and families. The Valentine Clinic is where outpatient training comes to life. Residents will manage acute needs, chronic conditions. They'll manage senior care supported by on-site lab services and pharmacy services. Here, you'll practice team-based care while drawing on BHA's system-wide specialists, including podiatry services, infectious disease, behavioral health, and dental. You'll also rotate through other BHA clinics, encountering diverse patients and settings that strengthen your outpatient skills and broaden your experience. Combined with inpatient training at Palm Bay, this ensures well-rounded preparation in family medicine. And at Brevard Health Alliance and Health First, we're prepared to the next generation of family physicians. You're going to grow as a clinician while making lasting difference in patients' lives. And beyond residency, Space Coast, as you see, offers beaches, rocket launches, and a welcoming community. So we look at the family medicine program mission and vision and values, and you can see that aligns with both Health First and BHA values. And really our goal is to provide and train skilled, compassionate family physicians who are equipped to deliver exceptional care, patient-centric care. We're going to look at each individual. We're going to look at your goals and your personal goals in terms of specialties or subspecialties within family medicine. And we're going to line that up with great mentors in our program. So in regards to our vision, we're going to improve the health and wellness of the communities that we serve in Brevard County. And as mentioned, our values are going to include the wellness. We want to focus on physician leadership, and you as residents become leaders in your respective fields, collaboration, and lifelong learning. So what we're going to do is we're going to move along now to our faculty, and specifically our core faculty in family medicine. So I am going to let some of our faculty members here introduce themselves as well. So Dr. Fox, I'll pass it on to you.
Hi, everyone. My name is Nicolette Fox. I am a physician, and I've been working with BHA in the outpatient setting for the past 3 years. I see all ages. I see children and adults, and I do some elderly care as well. I have a special interest in lifestyle medicine, and that is a program that we have had established at BHA for a little over the past 2 years now. And I really look forward to this new partnership with Health First and starting this residency program.
Thank you, Dr. Fox. And Dr. Moak, I'll move the torch to you.
Great, thank you. So I'm Dr. Lauren Moak. I am also a family physician. I've been with Brevard Health Alliance for about 5 years now. I trained at the University of Minnesota and then got sick of the cold and decided to come on down to Florida, and it's been a really great transition. I really love working with Brevard Health Alliance. It's a great mission driven organization with really incredible opportunities. I'm especially interested in women's health. I am our lead for women's health in primary care and perform a lot of women's health procedures like birth control, LARC placement, endometrial biopsies, and then do a lot of other procedures as well, like skin and dermatology, joint injections, circumcisions. I like to be hands-on. So I look forward to getting to teach and train residents in our program and helping you guys to be really hands-on and be connected with our patients, and then also to just provide that kind of full spectrum of family medicine care. I think it's really cool when patients come in and say, oh, I didn't know you could do that here, and I didn't know you could do this here, and within the spectrum of family medicine. So I think that's a really cool environment to get to teach and share those skills and share that with our patients.
Thank you, Dr. Moak. And Dr. Chuyik will speak on Dr. Wolf, who unfortunately is unable to attend tonight.
Yes. So Dr. Wolf is working tonight, and she specializes in inpatient adult medicine, and she's been doing that for over 7 years. She has a passion for teaching inpatient procedures and will be part of our hospital faculty. In addition to our core faculty, I just wanted to mention we have over 20 community teaching faculty as well, and they're all very excited to work with our residents. Next slide. Great. So the curriculum overview for family medicine, we have both inpatient and outpatient. Our outpatient will be primarily based at Brevard Health Alliance clinics, and the inpatient setting is going to be at our Health First Palm Bay Hospital. That's going to be our primary site, but we do have our residents rotating at Holmes Regional Medical Center, and that was mentioned earlier. Next slide. So a little bit on our inpatient curriculum that's occurring at Palm Bay Hospital. As you see in our picture here, there is a big expansion coming to Palm Bay Hospital. It's supposed to be completed in 2028, and we're on track for that. The most important thing to know about this hospital is that the only residents that are going to be at Palm Bay are going to be our family medicine residents. That means that it's a non-competing, unopposed experience for our residents. Some of the rotations that are planned to happen here are our adult inpatient, general surgery, gastroenterology, night float, ICU, and essentially our residents will be working one-on-one with the specialists and be able to get their undivided attention and their invaluable experience and knowledge. Some other things that are to note about Palm Bay Hospital, they have their emergency room, and the residents can take part in all the traumas that come through the door through their electives. And Palm Bay has some specialized services, such as the diagnostic radiology team, the thoracic surgery that they do, cardiology, the cath lab, and they have an advanced stroke center and orthopedic surgery center. So a lot of wonderful things and things to experience and to grow your knowledge in residency. Next slide, please. Okay, I'll pass it off to Dr. Moak, who will be talking about our curriculum.
Great, thank you. In terms of our outpatient or our curriculum overview, as Dr. Chuyik mentioned, the inpatient medicine will be at Palm Bay Hospital, and that does start off in PGY 1 year with 3 blocks. We're really kind of building that family medicine foundation, getting a good inpatient medicine, as well as a lot of kind of general family medicine topics. So we have a block of newborn, a block of dermatology, a block of general surgery, block of emergency medicine, obstetric medicine, podiatry. So a lot of those really great hands-on kind of basics. There's also a block of pediatric outpatient medicine. So we do integrate that into our family medicine rotations, but also want to get that kind of focused care on pediatrics, and then a community medicine and population health block. We also do have 2 electives in the PGY 1 year, just to start allowing residents to really explore their own interests and trying to start, if they want to focus, getting their feet wet with that. Next slide. So then PGY 2 year, still a good foundation of that adult inpatient medicine with 2 blocks, and then also a pediatric internal medicine block, which will partner with our hospitals in Orlando for pediatric, another pediatric outpatient medicine block, and then again, some of those specialties, so endocrinology, emergency medicine, obstetrics, the medical ICU, behavioral health, geriatric medicine, ENT, and again, 2 elective blocks there for kind of choosing your own adventure. And then in the PGY 3 year, really trying to focus on building more resident independence, leadership skills, and really getting residents prepared to do kind of the roles that they want to pursue after residency. So again, staying strong with that adult inpatient medicine, being the lead residents on those rotations and taking more of a leadership role. doing some sports medicine and orthopedics, some health systems management rotation, which is really valuable as you prepare to go into practice and trying to, understand how to either start your own practice or integrate and lead in whatever practice you're joining. Hospice and palliative care, addiction and pain management, gynecologic medicine. There is a block of night float to really kind of get that independence and more well-rounded skills on the inpatient medicine side, and then 3 electives in that 3rd year. And I'll turn it over to Dr. Fox from there.
Thank you, Dr. Moak. So to ensure that you have the best experience, we would like to ensure that you're exposed to a number of different specialties to prepare you to function on your own when you go out there and practice upon completion of the residency program. And also just to explore some interests, as Dr. Moak had mentioned, in any particular areas that you like, because we all have certain things that we, tend to gravitate toward, but we do want that solid foundation and just to have that focus. So some of the electives that will be available, again, to strengthen that partnership between Brevard Health Alliance and Health First, we would partner with some of the specialists in the community, and that will range from various specialties such as allergy and immunology, gastroenterology, cardiology, ENT, gynecology, infectious disease, nephrology, radiology, pulmonary, rheumatology, sports medicine, just across various specialties, as you can see here, just to ensure that you have a wide range of exposure. And then within BHA, as you mentioned, there are some of us who have special interests. So myself, I do have an interest in lifestyle medicine. Dr. Moak really focused on, women's health. Dr. Shuck tends to do a lot of procedures. So things like that, just to allow you to really expand upon your interests. Next slide, please. And we, as I said, intend to provide you with a, vast experience. And we plan to do that with expansive evidence-based educational experience, not just through your clinical rotation, through some structured learning opportunities as well. So this will include settings where you can participate in things such as journal club, grand rounds, morbidity and mortality conferences, some quality improvement projects as well, board review, specialty specific didactics, where we'll have some of those specialists come and provide you with lectures, simulation and skills development, radiology rounds, and morning report sessions where residents will be participating in. And I will allow Dr. Chuyik to expand a bit more on the resident experience.
Thank you. So our intention is for us to create a resident-centered experience for you all. So residents coming to our program will be a part of the mentorship initiatives that we have. They'll have resources to build and grow their careers. They'll be able to attend networking events and have access to job opportunities after graduation. Residents will also be able to participate in scholarly activities and research initiatives that are in collaboration with the Burrell College of Osteopathic Medicine. Residents will also take part in our wellness initiatives of both Health First and Brevard Health Alliance. Apart from those structured programs, just living on the Space Coast will be a key part of our wellness. And I've experienced this myself since I moved here. There's no other place that you can go surfing in the morning before work or after work. Or if you're not into surfing, you could take a nice stroll on the beach right after getting out from clinic or the hospital shift. The other thing to mention here is, as you become a Florida resident, you'll be able to snag some discounted cruise trips and just enjoy a weekend on a cruise, come back, see some patients, learn some medicine, and then repeat your weekend. So it's really a fascinating experience during your residency training here. So in a nutshell, our residents will have an amazing lifestyle and can be part of shaping the future of our residency program, which is something that's very exciting, and not everyone gets a chance to do that. Next slide. So we plan on welcoming 6 residents in our first class of July 26th. sorry, I'm skipping ahead. Just to mention some additional resident certifications here. We are going to be able to provide our residents with a faculty appointment at Burrell College of Osteopathic Medicine. And in addition to that, we plan on having our residents gain a CLIA certification, which basically means that it puts you one step further or towards becoming a medical director after graduation and understanding what that process looks like, serving as a medical director, or if you plan to have your own practice or your own urgent care, being able to have a lab in that setting. You'll be able to understand what that process looks like. So what are we looking for? So we are looking for people that are very much like ourselves, team players who value collaboration, those who are committed to community, have a passion for family medicine, and an individual who's very adaptable, mission-driven, innovative, and a true leader in family medicine. Onto our recruitment process. So we do plan on welcoming 6 residents, as I mentioned, and our first class is set to begin in July 2026. Because of our experienced leadership team that we have here, we're pretty confident that we'll be on the right path towards achieving ACGME accreditation, which happens in a few weeks during late October. And then our program will be open in ERAS for applications from our residents to come on through. We do plan on having virtual interview dates, and they're going to be from November primarily, but also occur through December and January as well. Next slide. I'll pass it off to Dr. Shook.
Thanks, Dr. Chuyik. What I wanted to mention is, in the confines of both Health First and Brevard Health Alliance, we really put a special emphasis on community and team-based care. What we can do as physicians, you'll soon understand that you can't do it without a good team. We have a lot of really neat, different settings that we work together in. We all have different community events that we participate in. We have community picnics. We have provider clinician dinners. We have huddles in the morning where we meet up. We have monthly meetings. So there's a lot of interaction amongst your team. And really, what I think you'll soon understand is that we have a special focus on family, and we all work together. We're all, one family. And I'll also make mention, and I know as Dr. Chuyik mentioned, this county, this part of Florida is unique. Where we're at, it's compared to other areas in Florida, cost of living is not as expensive. We have 70 plus miles of beaches, and our county is long and narrow, and all of it is by the ocean. So if you enjoy the ocean, you enjoy outdoors. It's a fantastic place to live. I go surfing at night if I need to, unless it's hurricane weather like it is right now. You can golf. You can go out on the river and do some kayaking. It's a great family setting too. There's great schools in our county. We have the Kennedy Space Center. We have the King Center if you enjoy arts and festivities. We have Cocoa Village and Oak Alley Arts District. So there's a lot in our county to do. And with that, I'll open it up for any questions you may have, and feel free to ask or write that down in the chat for our team.
I had a quick question. Are you able to hear me all right?
Yep, we can hear you.
Okay, perfect. Hi. Well, thank you so much for this presentation. It was really informative and really excited about applying to the program. So my question was, what kind of opportunities lie for residents outside the clinic in terms of community initiatives, especially with underserved communities or rural areas nearby?
It's a great question. As mentioned, within Brevard Health Alliance and that Health First partnership, we're a federally qualified health center. So we do a lot of community events, community-based services. We have local schools with underserved population that we actually work within the confines of the school to see some of those underserved students. We have there are certain programs that you're actually eligible for in Florida, such as the frame, we call it, which is the Florida. It's basically student loan forgiveness, and within that you need community-based hours, so you can do some local volunteer work for that specifically. So we really do a lot of outreach in regards to that.
On the health first side, we run an every 3-year community health needs assessment, and that leads us to expanded community partnerships with, I think we're up to 38 different charities in the community who are serving largely an underserved population in the area. And so there are tons of volunteer opportunities through those community partnerships. And actually, a BHA, they have a seat at that group that decides some of the partnerships that we embark on. So the synergies are pretty significant.
And I just wanted to add, we also have a really neat mobile van that delivers care to the underserved areas. And it's something that the population has just been benefiting from over the last few years.
Thank you so much.
You're welcome.
Hi, good afternoon. Thank you so much for the presentation. You have no idea how excited I was to hear that Brevard is having a residency program, because I grew up in Brevard and I really wanted to give back to the community that raised me. So my question, it's more clarification, but so this program isn't currently on ERAS yet, is that correct? It'll open in October?
Yes, that's correct. We are waiting our credentialing, so we will hear in hopefully mid-October regarding credentialing, and we're very hopeful that we will receive it. So once we receive credentialing, we will be on ERAS.
Okay, sounds good. I also have another question. So will FM residency still be unopposed as you add in more residencies, like internal medicine, OB-GYN, all that?
That is the plan. So we plan to have the FM residency based out of the Palm Bay Hospital. A lot of the other residency programs will be based out of Holmes Regional. So, you know, we have that. I went to an unopposed residency, and I think it was extremely beneficial for my career.
Yeah, I agree. What future plans do you have specifically for FM residency? I know you guys spoke a lot about electives. I also want to know, like, what electives do you guys have in mind that you offer?
Dr. Chuyik, if you want to maybe answer that one.
Yeah, sorry. Could you repeat your question?
Okay. What future plans do you have for FM residency? I know like first class is always kind of like a guinea pig class, but like, you know, like, is there a structural plan that you have in mind?
Yeah, great question. So it's a big question, and we actually have everything planned out for the residency program. So as Dr. Moak went over, we have all of your rotations scheduled. We've worked with over 20 teaching faculty in our community that are so excited to have a resident start. So they're all just waiting for a resident to start. And in terms of, I think you mentioned, you know, the initial class, I see it as the leadership class because you're helping us shape what that residency program will look like. And there's room for us to grow into fellowships. There's room for us to grow into specializing in more patient care directed areas like women's health track, hospital medicine track, things of that nature. It just depends on the needs that our residents have, and we are very open to, you know, planning our residency program and building it with our residents as well. As I said, we're really resident centered. I didn't know if that addressed your question.
No, I think it did.
Okay.
I was also going to ask about fellowship opportunities, but like that will probably, I guess, develop as time goes on.
Mhm. Yeah, in the very near future, I foresee, because we have so many specialists here.
Got it.
And I'll add to what Dr. Chuyik was saying, but you know, we have a lot of great local partnerships within the confines of Health First, Brevard Health Alliance, and even other independent groups. So you know, we have the connections to develop the rotations. the cool part about the first year is like you know, joining as a first year residency program, you guys get to grow it and to, you know, do what you want to do to help us grow it. So I think that'd be really neat to be the first class within the program and have almost free reign to kind of do what we want to do with it.
Regarding didactics, like the first year, would you allow residents to present cases and like, you know, lead grand rounds and such?
Yes, great question. I'll take that one, Dr. Shuck. So we will is the short answer to it. We do have good didactics, grand rungs built into our didactics for residents to present really interesting cases. We also have the opportunity for those interesting cases to be built into scholarly activity and presented at conferences throughout Florida and on a national level. So we're working hand in hand with BCOM, Burrell College School of Osteopathic Medicine, to make that happen for our residents.
Great. I'm sorry, I feel like I'm bombarding you guys with questions.
No, we
I
welcome
also
them.
wanted to ask about, I guess like step 3, complex 3 support, like what would the timeline for that be? Like when would you require residents to have taken that? And will you like, I guess, you know, like provide like question banks and like CME for that?
Yeah, excellent question. And there's no bad questions. Please keep them coming. So we do have a lot of support for the step 3 takers because most medical students haven't taken their step 3 by the time they get to residency. Um, the the rule of thumb is we would advise our residents to take it before December of PGY 2 year. That is across all family medicine residencies. Um, and of course, if there's CME that our residents will be given, and residents can use that CME monies to also access board review questions or questions to prepare for COMLEX. And then we as a program will also be tapping into resources to help you excel in step 3 as well. And our didactic sessions are really tailored to not just the boards, but also preparing you for your step 3. So I think most of our residents will be fine.
Sounds good. Thank you so much.
Hi everyone, my name is Liliana. Like everyone said, thank you so much for the presentation, for having us here for this open house so we can learn about your program. It's very exciting to see a new program opening in Florida. My question is related to how are the inpatient versus outpatient experiences going to be balanced? On my last family medicine rotation, you would go in the morning to the hospital, you go in the afternoon to the clinic. Do we have an idea how we're going to balance those inpatient versus outpatient experiences?
Yeah, that's a great question, Liliana. So the policy for ACGME says that we need to make sure that you have continuity of care, which means that you do have that experience of going to clinic even if you're on your inpatient rotation. And it's important for us to give that care to our patients too. So we don't delay their cares. So when residents, pardon me, are on inpatient rotations, we plan to, at the very minimum, have them see their patients a half day a week. And Dr. Shook, myself, and the family medicine team are working on marrying that with a hospital follow-up program. So these will be patients that you see in clinic, but they were recently in the hospital. So that continuity of care carries over really well from inpatient to outpatient. Does that make sense?
Yes, that's perfect. Thank you.
Okay.
And my other question is related to obstetrics. Are we going to have a robust training in obstetrics, a lot of hands-on experiences?
That's a good question. We should have that opportunity. So within Brevard Health Alliance, we have an obstetrics department. They do all outpatient OB, and then within that department, our chief of women's health, Dr. Marian Lynn Perry, who's going to be on faculty with us, does all the inpatient experience as well, and her team does inpatient. So there should be more hands-on with obstetrics. And it just depends on, we have the minimum criteria needed, but if you had the interest in women's health and obstetrics, you would have more opportunity there in your elective time.
Great, thank you so much.
You're welcome.
Hi,
I'll put a
everyone.
plug in for Dr. Perry. Dr. Perry, I think she might be the chair of OBGYN at Holmes. She's an extraordinary physician. She's just great.
A great teacher too.
Yeah.
Hi, everyone. My name is Jasmine. I just wanted to say that I've thoroughly enjoyed the presentation. I got to enjoy Cape Canaveral quite a bit because my husband works for the Space Coast, so it's very exciting about your program. One of the questions that I have is that will the accreditation be for the entire 3 years for the family medicine program, or will there be some site visits that will be scheduled throughout the residency?
I can take that one. You're talking about site visits from ACGME?
Yeah.
Okay, great question. So this is a new program. So technically, we'll have a site visit in 2 years.
Okay.
And that depends if we're doing a great job, which I have no reason to see why we won't. We've prepared so much. That site visit could be virtual, or it could be in person. So it just depends, but it always happens in 2 years.
Okay. Awesome. Thank you.
I had another question, if that's all right. Because this is a new program, what type of, I guess, feedback systems are in place where residents are able to help shape the program? Is it a structured sort of system that's coming into play?
Yeah, great question, Jazrina. So feedback will be very pertinent as we build our program. We have something called the PEC meeting, which is a program evaluation committee that meets often, and a resident or two have to be a part of those meetings. So residents will be giving their feedback and we'll be seeking those feedback because they're going to be structured into our residency programming. The other part that we can have feedback if residents are a little shyer and don't want to express it at a committee meeting is one-on-one. Residents will have faculty mentors, and you can provide feedback that way as well. And then we'll also have the ability to provide feedback anonymously. We are going to be using a residency management system called New Innovations. And there's an option for residents to provide feedback anonymously as well.
Very cool. Thank you so much.
One more question. Will the program have medical students that we would have the opportunity to teach?
That's a great question as well. Currently, we do have medical students rotating through the outpatient clinics and rotating through Health First. We fully anticipate that the residents will also be working with the medical students. That's critically important for both the medical students and for the residents. So that is the plan.
And to add on to Dr. Shook said, our residents, we do plan on having a faculty appointment for our residents at Burrell College of Osteopathic Medicine because of that relationship.
Are there any other questions from the group this evening? Courtney, were there any questions in the chat that we needed to call out or discuss further?
No, the only questions in the chat have all been covered by the great discussion. Thank you, Ashley.
Wonderful. Well, Dr. Shook, I'll let you close this out for the evening.
Certainly. Thank you, Ashley. And I thank you everyone for participating and joining. And we very much look forward to the hopeful and anticipation of accreditation. So our next steps, keep an eye out on ERAS for the application. We will hopefully have everyone's contact. And once we get accredited, we will provide you with that information and then just look on the ERAS for applying. We plan on conducting virtual interviews starting in November and going through January. So we look forward to meeting everybody and speaking more closely one-on-one. If you have any questions, further questions for us, please reach out to us, gme@healthfirst.org, and we will get back to you as quickly as we can. And you can also follow us at Health First on all the things to follow us on. So, please don't hesitate to reach out at any time with any further questions. And again, thank you everyone for participating.
Thank you so much for everything.
Thank you so much.
Thank you.
Thank you.
Good night. Thanks for having me.
Thank you, Dean Newman.